Hello everyone, I'm Anjali Sidhu, founder and CEO of OmniStar, a healthcare and IT staffing solution company. Today I had the greatest honor to connect with Dr. Abha Aggarwal, who was the former CEO and president of Lawrence General Hospital and Holy Family Hospital. She's a renowned figure in the healthcare industry, and I got a chance to pick her brain on how AI is disrupting the healthcare industry. So here we go. We're starting with our first post. Thank you. Good morning, Dr. Abha. It's such a pleasure for me to be with you here. And really, I'm getting a chance to pick your brain, what you think about the future of healthcare and how we can reduce the burnout in the healthcare industry.
Absolutely. Thank you, Anjali ji. It's a great pleasure for me to speak to you and your audience, and I appreciate the opportunity. I'm a physician. I have been in healthcare and hospital industry pretty much all my life, and I absolutely feel it's a privilege to perform work every day that has a positive impact on lives of patients and communities. Having said that, you touched on something that is so important in healthcare industry right now. We are facing unprecedented challenges in healthcare these days. Uh, there is a record amount of workforce related challenges. There is shortage of nurses, of physicians. They are leaving the profession. They are stressed out because of all the administrative documentation burden, and they feel they are not operating at the top of their license, what they are trained to do. People go into healthcare because they enjoy taking care of patients. They are dedicated to that. Right. And when that is taken away, it's not helpful. They also is also unprecedented financial challenges in healthcare industry. There is a Kaufman Hall report that came out just recently. Says 37% of the hospitals had negative margins. Wow. So that obviously is a major challenge because no organization, industry can survive with ongoing financial challenges. And these challenges stand to be even more exacerbated because of the recent potential federal policy changes that might impact two of the most important government insurance programs, Medicaid and Medicare. Right. Because a major reduction in those programs would cause potentially severe impact on patients who need care. And as we go into solutions, I do want to say there's people need to support advocacy and policy organizations that are doing extraordinary work. There is a DC-based national organization, America's Essential Hospitals, that is taking the lead, American Hospital Association, locally Mass Hospital Association, Health Equity Compact locally that is fighting to keep health equity intact. So there is a lot of well-intentioned organizations that are working to address these challenges that healthcare industry is facing.
Yeah. So, I think these challenges need to be addressed ASAP because we are seeing the the age is also increasing, normal age of the human beings, and so we have more old age population, plus we have, as you said, the doctors and all these people are also getting burned out and all that. So I want to know, how do you think that AI or these technologies will help in reducing the burnout?
Yeah, before I go into AI, you mentioned something. With an aging population, access to care is becoming a challenge, especially access to primary care. Massachusetts is the home of some of the best academic medical centers, teaching institutions, and we produce world-class physicians here. As you know, I'm new in Massachusetts, moved here a year ago. The access to primary care in Massachusetts is extremely challenging. Matter of fact, I applaud Governor Healy for talking about access to primary care in her State of the Commonwealth address. And then the Health Policy Commission head, David Sells, to create a primary care task force to address the challenges of primary care in the Commonwealth. Having said that, what do we do when we are faced with such challenges?
Right.
As you know, in challenges lie the seeds of opportunities.
Right.
Do we have the mindset of a disruptive mindset that can then harness these challenges and convert those into opportunities? We cannot continue to do things the way we have been doing for decades. And as Dr. Kiran Bedi, that as Indian iconic, the first woman police officer, said, you have to choose courage over comfort in order to make the transformation change. So that's really what we need here. Let's talk about workforce, AI, and teams. There is a very important concept that I want to share with you and your audience. Many decades ago, the care delivery was very physician-centric, right? Physician is the captain of the ship and delivers care.
Right.
Then we realized that is not the best model, and we said it is a team-based care model. So physicians, nurses, pharmacists, social workers, everybody comes together as a team to deliver best care for the patient. Then we added a component to this in the evolution of the team, which was patients and families. And we know now that engaged, activated patients and families are a critically important part to deliver safe and high quality care. I would submit that it is time for us to add one more member of the delivery team, which is artificial intelligence. What can AI do to enable the rest of the team to provide the best care? AI is not about replacing doctors and nurses, because that's where everybody goes. AI is going to replace doctors, replace radiologists. That's not the concept. It is allowing healthcare professionals to practice at the top of their skill and their license. And that can be very helpful. That can be instrumental in reducing the stress and burnout and allow them to the joy of medicine, joy of practicing medicine again, joy of practicing healthcare again. And I would love to share with you some innovations in AI and use cases as to what is happening these days that could help us reclaim the profession as well as have tremendous positive impact on the industry. So I think the thing I say is the best thing AI can do for many professionals is give us back the gift of time. So there are technologies like ambient listening and ambient scribing, which can take away the burden of documentation, administrative burden from physicians, and allowing them time to take care of listening to the patient, develop that empathy and connection, which is what both patients and physicians need. There is a very prominent physician, Dr. Eric Topol. He calls it the liberation from the keyboard.
Right.
That technology is available here and now and can have tremendous beneficial impact. There is also back-end operations. I think we need to focus on, we shouldn't think about AI is going to write prescriptions, provide care. We need to think, can AI reduce the tremendous operational friction that exists in healthcare industry? Prior authorizations, denials, administrative functions, scheduling an appointment, request of medical record. All of those things can be so easily done. AI can also be, before I go, I want to tell you about something which happened to me very, very recently. 2024 in Massachusetts, very advanced state. I was trying to make an appointment with a pediatrician for my son. I called a highly reputed pediatrician office, and here is what they said. before we make an appointment, you need to give us the past medical records.
Right.
I said, well, we moved here from Chicago.
Right.
He said, yes. I said, okay, can I email those to you? He said, nope, you have to mail them or bring them to us in person.
Wow.
This is in 2024, where everything is digital, right? So we need to get out of that mindset. We need to get out of that mindset. I mean, I think AI can be, besides this efficiency and friction, there's some incredible, new things the AI is finding out and doing that are not possible with the humans, because it can find hidden patterns in the data that are not visible to the human eye. Right? It can do better diagnosis.
Right.
I was at this Harvard School of Public Health participating in a panel discussion yesterday, and the chief experience officer from New York Presbyterian shared that there are billions of EKGs are done in the country, and AI can look for hidden patterns in the EKG and detect structural heart disease before it is visible to the human eye, and those patients' lives are transformed. AI can detect early sepsis, potentially saving millions of lives around the world. We should also remember, before I come to the challenges of AI, is the equity part of AI. We are talking about the US, but so many places in the world, there is no access to care. There is no access to ultrasound. And AI can also talk about global health challenges in an affordable manner by providing a cheap bedside ultrasound where no ultrasound is available. Right? So it is tremendous potential if we are ready to harness those potentials. But it also has tremendous challenges that we should be aware of and we should talk about.
Yeah, this is amazing. This is such a great insight.